The chair recognizes Senator Wilhelm for opening remarks on Senate Study Bill 3066.
Thank you, Madam Chair. A subcommittee and myself, Senator Garrett and Senator Taylor, with myself and Senator Taylor signing the subcommittee report.
Would you like opening remarks, and are there amendments?
Thank you, Madam Chair. This is a bill that is in regards to the implementation of a public awareness campaign in regards to Alzheimer's. I would like to go right to the amendment, if that's okay.
Do.
In conversation, there is an appropriation of $100,000 in order to keep the cost down. It was decided to use a sole source provider, or use a sole source, I should say. And this hopefully will keep the administrative costs down, and that's what the amendment is about. I'll answer any questions.
All right, discussion on the amendment. Any discussion? Seeing none. How do you wish to vote on the amendment? Short form has been called. All in favor say aye.
Aye.
Opposed? Amendment passes. We're back on the bill.
Thank you, Madam Chair. I would like to take any kind of comments from
Yes.
anybody in
Is
regards to
there-
the bill as amended.
Thank you. Is there any discussion on the bill? Yes, Senator Garrett.
Thank you, Madam Chairman. I just want to make a couple comments. I did not sign the subcommittee report, and I'm as concerned as anybody. We've all been touched by Alzheimer's, and I want to do everything we can to fight that disease and hopefully come up with a cure at some point. I didn't support this bill because we know already that we're in a deficit for this year. We're already, all the budget proposals I've seen indicate we're going to be spending more money than we're taking in. We're going to spend down the surplus even more than we have already. And so even though this is a worthwhile cause, I just don't want to start spending a little more here and a little more there when we know that it's spending money we don't have, that it has to come out of the surplus if we're going to do this and other things. So that's the reason I voted against it. It's more for fiscal reasons than it is any problem with the idea of trying to fight Alzheimer's.
Thank you, Senator. Any other discussion? Senator Wilhelm, final remarks?
Thank you, Madam Chair. Senator Garrett, we're always wanting to do a balanced budget, and we all do that. This is the first step in a conversation about Alzheimer's and a policy to make the public more aware of it. As you're probably aware, this will go to Appropriation Committee afterwards, and hopefully that discussion you'll be included with about the $100,000 at that time. What I want to say is that, we all, like everybody knows, and you mentioned, that we've known someone that's been touched with Alzheimer's. My mother had Alzheimer's. She lived it by herself on the farm after my dad passed. And I don't know if it was because of my medical background or being aware of it through public health in the clinic or the hospital I worked at, but I have 4 older sisters and 1 younger brother who, maybe because they weren't in the type of, or had previous situations with people with Alzheimer's, never saw my mom starting down that road or path. It got to the point that she couldn't make the decision of where she should or live at. And once my sisters saw the definite need of supervision because she couldn't be at the farm any longer. Now, would that have changed with this bill? I don't know, but I think we have to do that step. I think we got to make people aware that, and especially the caregivers out there, that there is Alzheimer's, we have to, and the symptoms of it, and also have the person that maybe starting down that road can still make their own decisions. So I'm very supportive of this bill, and I hope the committee supports it and votes yes.
All right. How do you wish to vote, Senator Wilhelm? Short form. Short form has been called. All in favor say aye. Aye. Opposed? No. All right. There are no. Let's do record roll call then. A record has been called.
Just be registered
Or
as to how the
all
ones
right.
that are no.
Registered as a no. Senator Garrett, Senator Costello, Senator Johnson. Thank you. All right. Okay, we ask unanimous consent that Senate Study Bill 3066, as amended, be sent directly to the calendar as a committee bill under Rule 40. All right, let's go on to our next bill. The chair recognizes Senator Taylor for Senate Study Bill 3073, meningococcal immunization, for opening remarks on the bill. Senator.
Thank you, Madam Chair. Your subcommittee of Taylor, Allen, and Shelgren recommend passage of this bill. Senator Shelgren did not sign this. He had some concerns, and I have not heard back from him yet. I approached him, but his only concern was that there was no provision to opt out of this. It's a meningococcal immunization that's required for 7th and 12th graders. Earlier in the state law, in another part, it does allow for opt-out for religious or health concerns. If there are no questions, I'd move the bill short form.
Okay, is there any discussion on this bill? Seeing none, short form has been called. All in favor say aye. Aye. Opposed? All right, we have one. Senator Costello is opposed. All right. We ask unanimous consent that Senate Study Bill 3073, as amended, be sent directly to the calendar as a committee bill under Rule 40. There is no amendment on the bill. Okay, not as amended. I'm sorry. All right. Is everybody clear as mud now? Let's go on to Senate File 2032. The chair recognizes Senator Yoakum for opening remarks on Senate File 2032. Senator.
Thank you, Madam Chair. Your subcommittee of Senators Yoakum, Garrett, and Wilhelm recommend amendment and passage. All three senators have signed the report. The bill looks a little more complicated than it really is. Basically, in a nutshell, this is what we're attempting to do. We are adding care coordination as a reason to disclose behavioral health information. And we make reference in the bill to Chapter 135D, but that is only so that the definition on care coordination is consistent between those two chapters. Other than that, that is the only reason 135D is even mentioned in this legislation. There is an amendment.
Right, proceed with the amendment.
During our subcommittee work, it was brought to our attention as more of a safeguard than anything else to make sure that no one ever goes beyond HIPAA laws or other regulations in terms of trying to step beyond the privacy of health patients. So the amendment before you just simply states over and over again throughout the bill that for purposes of care coordination under Section 135, if not otherwise restricted by federal law or regulation. We're just making that clear throughout the entire bill, and that's all the amendment really does.
Any discussion on the amendment? All right, seeing none, how do you wish to vote?
Short form.
Short form has been called. All in favor say aye.
Aye.
Opposed? All right, we're back on the bill.
Okay.
All right. Any discussion on the bill as amended? All right, how do you wish to vote?
Short form, Madam Chair.
Short form has been called. All in favor say aye.
Aye.
Opposed? All right, ask unanimous consent that Senate File 2032, as amended, be sent directly to the calendar as a committee bill under Rule 40. All right. Now we'll go on to Senate File 2049. The chair recognizes Senator Yoakum for opening remarks on Senate File 2049.
Thank you, Madam Chair. Just briefly, a little bit of background. This is in reference to the children who are covered under the Healthy and Well Kids of Iowa program, also known as Hawkeye. And that is Iowa's version of the CHIP program, which is a national federal program under Title 21. Expanded health care to children who were not eligible for Medicaid, and yet their parents didn't earn enough money to really have health insurance. So the parents do pay a very minimal premium for their kids' health insurance. Here's the problem that's emerged. As the governor's effort to privatize our Medicaid system has unfolded, we had two companies that provided health insurance to children in the Hawkeye program, United Health and WellCare. United Health, as of December 31st, WellCare dropped out of the program. So the only one that's left now is United, providing coverage for these kids. Oh, what'd I say? Oh, no, I meant Wellmark, sorry, WellCare is not the same thing at all. Blue Cross Blue Shield. So Blue Cross Blue Shield dropped out of this program. So United Health is the only place parents and the kids have for this program right now. The problem that has emerged is that Wellmark did provide for speech therapy coverage in their plan for children. United has often denied those claims, and they now have this definition of when you're eligible that would apply to an adult, not a child. For example, well, the bill says it. So basically it says speech therapy is only covered following a patient's stroke or due to an injury or surgery to the head or neck. Well, that doesn't apply to most children. That's not the reason why they need speech therapy or language therapy. So the bill before you is basically just telling United, you know what, you're going to cover speech therapy, and that it's going to be, that they can't deny it by interpreting loss or impairment due to a stroke, accidental injury, and so on. There is an amendment.
Yes. Would you like to discuss this about the bill or about, we're going to call for an amendment?
It's a simple question.
Okay. Go right ahead, Senator.
Thank you, Madam Chair. The question I have is, if this passed, will they have to go back to previous claims and make adjustments to, is that?
With the amendment, it's going to say it becomes effective upon enactment, and then it's retroactive to March 1, depending on when this would pass.
Okay, so-
What United did say is that they would now honor any child's speech therapy up until 2017.
Okay, thanks for
Okay?
clarifying that.
So we're just trying to make sure these kids are getting coverage, that they aren't using this interpretation to deny them speech or language therapy.
Senator Yoakum, would you like to proceed with the amendment?
Sure.
And explain anything more on that?
Don't have to really explain much more. All the amendment does is say that it's because of immediate importance, it takes effect upon enactment, and then not knowing when this is going to pass, et cetera, or if CMS is even going to give Medicaid managed care the green light on March 1, it's retroactive to March 1. So we're covering that window on speech and language therapy for kids.
Is there any discussion on the amendment, or Senator Siegebart, do you have more questions at all? Okay. Anyone else? Anyone else? Discussion, questions? All right, how do you wish to vote on the amendment?
Short form.
Short form has been called. All in favor, say aye.
Aye.
Opposed? All right, we're back on the bill as amended. Senator Yoakum?
I just move the bill as amended.
Okay, any more discussion? All right, seeing none. Short form has been called. All in favor, say aye.
Aye.
Opposed? All right, we ask unanimous consent that Senate File 2049, as amended, be sent directly to the calendar as a committee bill under Rule 40. Now, we are on Senate Study Bill 3081. The chair recognizes again, bingo, Senator Yoakum, it's your day for opening remarks, again on Senate Study Bill 3081.
Thank you, Madam Chair. Your subcommittee of Senators Yoakum, Johnson, and Wilhelm are recommending passage. All three senators have signed the report.
Okay, are there any amendments?
There are not any amendments to this bill.
All right, is there any discussion on this bill? Yes, Senator Siegebart?
Thank you, Madam Chair. First question, if this is enacted, what's the system that's going to pick up the pieces? And will that system be ready to do that immediately after we cut ties with managed care?
Okay, so you're right. The bill before us does two things. One, it direct the department that upon enactment of this legislation, that they are to give a 30-day notice to the managed care companies that the contracts are terminated. And then it goes on to say that the department will continue to pursue other initiatives to improve the Medicaid system. And the suggestion is that we continue to follow some of the transformational provisions or measures that we have been using for the past few years. For example, accountable care organizations, integrated health homes, both of which have shown to be very cost effective for our state, saving many dollars and expanding health care to children, to women who need mammograms, and so forth. So the answer to your question is this. When the Centers for Medicare and Medicaid Services came to Iowa in December and then decided to delay for 60 days, that was one of the issues they sat down and discussed with the department. What is your contingency plan if we delay or reject the governor's plan?
Which could still happen, by the way.
It can. So the department is supposedly has contingency plans in place and continue to pay for these services through fee-for-service in the regular Medicaid system. So that's how we would continue until or unless we come up with an Iowa plan that I would hope would involve the legislative branch, executive branch, stakeholders from across the state to really come up with an Iowa plan that responds to the real health needs of Iowans, especially Iowans with very complicated health issues. And that's what this is covering. As you know, Medicaid covers very complicated health issues. So that's kind of our thinking on this, and that the department should have contingency plans in place. Because there is no guarantee on March 1 that CMS is going to give the green light. They very well may delay it again. You know, it depends on how robust and our provider network is in the state. And the last we have heard, their words were, it's a very thin network. And I think all of us have received numerous phone calls and emails from our constituents for months now about the problems and the angst and the anxiety. And I know in my own community, not a single medical doctor has signed contracts yet. And we're the 8th largest city in the state. And none of her waiver providers have signed on yet. So all the folks in Dubuque are kind of in a world of hurt right now on what to do. So we're saying, stop it. Just stop. Let's start over.
Senator Siegebart, do you have any follow-up? Okay, Senator Bolcom.
Thank you, Madam Chair. Madam Chair, thank you for bringing this bill to the committee to stop Medicaid privatization. The reasons initially that this legislation, or this, I should say, this effort by Governor Branstad to privatize our state Medicaid program was allegedly to save money. But it seems odd to me that saving money by making 3 questionable Wall Street companies rich is a very strange way to save money. Because I think we know they're going to cut services to consumers and they're going to cut reimbursement to our providers that need those services. I think across the country this is not working very well. I know we also cite, well, they're doing it in all these other places, then we should do it here. I don't think the record's very good around the country. It's going to cost more. I think it's going to be very damaging to fragile Iowans. And I would say if you want to save money, vote for this bill to stop the privatization. And if you want to ensure good health care continues to be provided for our people, vote yes on this bill. Thank you, Madam Chair.
Any other discussion? Seeing none, how do you wish to vote? Record has been called. All right, record has been called.
One absent.
All right, the bill passes on to, it passes 9-3. We ask that unanimous consent on Senate Study Bill 3081 be sent directly to the calendar as a committee bill under Rule 40. All right, is there any more discussion for the committee today? Do we need to do something else?
There was no amendment.
All right,
There was no
all right.
amendment.
Okay, we ask unanimous consent that Senate Study Bill 3081 be sent directly to the calendar as a committee bill under
Senator
Rule
Johnson
40.
would like to speak.
All right, Senator Johnson.
Thank you, Madam Chair. For the committee, and I mentioned this to our members, I believe tomorrow is Epilepsy Awareness Day. Has anybody heard that? But anyway, these are difficult, cases. It is, and not all of us agree on what the best approach is. But I just encourage everyone to take some time and consider, how tough this is. It's tough. It's a really tough thing, and we do have different opinions about what to do about that. But they'll be traveling from all over if the weather is okay. I think it is. I think it is, but it may not be tomorrow. It may be another day. But anyway, thank you for the work everybody on the committee did today.
Thank you very much. And Senator Dotzler moves that we adjourn.